Hiya, my name's Sarah Ellison. I'm one of the community matrons over in Ellesmere Port. My main role is to keep patients with complex long-term conditions well and avoid unnecessary hospital admissions. Thanks for taking some time out of your day today to hear my experiences about flu and really how my experiences potentially can impact all of you. So, I don't do things by halves. I've had flu twice in my life. The first time was 20 years ago. I was on nights as a junior staff nurse on coronary care. I walked into my shift absolutely fine, but then just before midnight I began to feel poorly. Within an hour I'd got muscle aches, could hardly walk, got sent home from work. Woke up the following morning feeling dreadful, classic flu-like symptoms, crawled to the bathroom, felt dreadful. My husband got it 2 days later. To be honest, I think he thought I was being a bit of drama queen up until that point. But then when he got it also, he realised how rough it made you feel. Got better, went back to work 2 weeks later. I have to say the first thing that I noticed was that there were no beds at all available in the hospital. And bearing in mind this is going back 20 years and that was a big deal then, that was unheard of. Every bed was full. Outside the back of the hospital we had huge refrigerated lorries, 2 of them, and the mortuary was full of our deceased patients. So the lorries had to have deceased patients in them, which was just awful for all of us to see. There were delays with funerals due to the volume of deaths, and this was not an epidemic, it was just a bad flu season 20 years ago. So when you think about what's happening in Australia this year, it's a real concern. So fast forward to 2012 and unfortunately I got flu again, although this time it was very different. I used to be a heart failure nurse before I did this job, and I'd just finished one of my heart failure clinics and I was talking to a practice nurse. That morning as I'd gone into work, everyone was telling me how well I looked. It was my first day back in work after having a cardiac pacemaker put in a number of weeks earlier. Within minutes of talking to this practice nurse that afternoon, I'd felt dizzy, my heart rate was through the roof, it was going at 160 beats a minute. I felt like my heart was trying to jump out my chest. The temperature was elevated, blood pressure, felt dreadful. Apparently I looked awful. I could see the fear in my colleagues' faces. I thought they thought I was about to keel over. Thankfully I didn't, and before I knew it I was in the back of an ambulance on my way to A&E. So you know it's bad when you get to A&E and they find a bed for you straight away. It's even worse when they won't let you go out the department. So I was there in A&E on monitors, on drips, oxygen on. It was even worse being a heart nurse because I was reading my own monitor thinking, oh God, this is not looking great. I was convinced I'd got a pacemaker infection. When you think it was only a couple of weeks earlier, I'd had wires screwed into the top and bottom of my heart. I think everyone else was thinking the same thing. Luckily, it wasn't a pacemaker infection. It turned out that it was flu. I couldn't believe it. My experience was 20 years ago. It was so different from then. The symptoms were different. I didn't ache at all this time. But then there was a different worry. Would there be a bed available? And not just any old bed. I'd need a monitored bed. The staff on the ward were brilliant and in A&E, but clearly their workload demand outstripped their capacity. As a patient sitting in a hospital bed, I had to switch roles. It was really hard to get my nurse's head off and put a patient role on. Really horrible experience to feel powerless and know that I was really quite poorly at the time. Thankfully, things settled down. So I think part of the reason I've been unlucky with flu is that I fall into one of the high-risk, vulnerable risk groups for flu. My mum, they think, caught rubella, germ measles when she was pregnant with me. As such, I was born with congenital heart disease. I've done really well up until these last few years, but now things, unfortunately, are starting to go pear-shaped. Back in my mum's day, there were not the immunisations available to children as there are today, and these children died of complications of measles, mumps, whooping cough. Today we are so fortunate we have these life-saving immunisations available to us, but we know there's been decline in uptake lately. Again, this is okay if the bulk of the population have got immunity, but as soon as it starts declining, we're all at risk. Those like me especially, but it's not just me, because when I get sick inadvertently, it can have a huge impact on everybody else. So, every year I get my flu jab, but I spend a third of my life in work surrounded by others who may or may not have got theirs because they feel well. Without sufficient numbers of people having the flu jab, I'm at greater risk of getting it, even though I've had it myself. And as we all know, this is down to herd immunity. So when I get a flu, I get sick. I end up in a hospital and I take up a bed. As I'm a heart patient, I need a monitored bed, and we know that these are in short supply and huge demand. There is nothing more terrifying than knowing that you or a loved one is really sick and there may not be a hospital bed available. This is the scary reality. We are already seeing Opal 4 and it's not even winter and flu season yet. To add to this, when the hospital gets full, acute medicine pretty much always takes priority over planned surgery. So even though it may not seem as though it's nothing to do with the flu, the hip or knee replacement someone's been waiting years for potentially gets cancelled, as you have people like me stuck in those outlying beds. Likewise, my poor colleagues in work have to work even harder when I'm off sick. This makes them tired, run down, more vulnerable to ill health. And as I say, when I'm off sick with flu, it's never for a week, it's for weeks on end. After my last episode of flu, as I say, I got really run down. I got whooping cough 6 months later. This resulted in loads of antibiotics, fractured ribs from coughing and more time off work. I've since had ongoing arrhythmias, I had pneumonia. Last couple of years I've had a TIA and sepsis. I tell you, I feel like I've had more comebacks than Rocky lately. My cardiac condition I can live with, but the implications of poor immunisations and lower rates of herd immunity put me and others like me at huge risk, and it potentially has the knock-on effect on all of yourselves. So I'm encouraging all of our staff this year and everyone that's eligible for the flu vaccine to get it for all of the reasons that I've said. We've got potentially a health time bomb looming. Reduced uptake of immunisations puts us all at risk. Antibiotic resistance is increasing, and for people like me, there is not a year that goes by that I don't need antibiotics. Demand on our hospitals, community and social care services is massive, and I don't know how we're going to manage if there was a flu outbreak. Imagine your child or loved one needing a hospital bed and there's not one available. So simple vaccines that take seconds can protect all of us, whatever our circumstances. My mum back in the day had no option, and the result is that I've been born with a lifetime of heart trouble. I'm so lucky that I've got 2 healthy sons who are well because of vaccinations. So, flu happens every year. The implications of it are far-reaching, and I bet each one of your teams has got somebody like me in them whose risk of complications from flu is huge. Please consider this when you're being offered your flu vaccines this year. And just to end, finally, be kind to each other. Tell the ones you love how much they mean to you. Not one of us knows what's around the corner, and as I know all too well, life can change in a heartbeat. Each one of us is going through our own battles, and disability may not always be obvious. Thanks for taking the time out of your day to listen. Bye.